Okay, so this one is kind of a brief one, coding surgical procedure. I was wondering if someone would give me a few tips on how to figure out the wording when coding a surgical procedure. I have the study guide, but the questions they ask without the multiple answers is where I don't know what to look for. I really appreciate any help you may have. Thanks, Mary. So with this, when you take a coding course, you typically start off with a few words like Ebola, and you go look it up in the index. And then you start building on that. And you might get a little scenario, a little blip. And then you get like real reports to kind of code. A lot of times, especially like with our CPC Review Blitz, we are focused on helping you pass the exam. So we do focus on multiple choice. But it does relate to the real world in that you will go to the index if you have a term, and it'll often give you a range of codes. It doesn't just give you one sometimes, but for the most part you go and you consult a range of codes, and you look at those codes and you compare them and you contrast them and you see which one best fits your documentation. So multiple choice training isn't necessarily a bad thing. So now you're saying, ooh, now I'm out in the real world and I'm like, no multiple choice. Where do I start? So I'm just going to take a quick report that I Googled earlier. So this is what first came up. It could be any report. Apparently this is a sample where they're trying to help their physicians know what an acceptable op report is. Physician education, coders get involved in it.
Yeah, very important.
This is a typical layout. You got the patient name and address, their demos, their demographics, their name, the date. Now this is where you want to start. You don't want to just code here, but these three things, preoperative, postoperative, and procedure, these are the diagnostic and procedural statements that you will be starting your coding from. So I believe the question was focused more on the procedure, so I'll focus on that. So here's the statement. And don't get excited. The doctors don't give you a CPT code.
No, that doesn't happen in real life.
Really. It just happened to be on the sample. So bilateral upper lid blepharoplasty. So they're getting an eyelid job. And that's misspelled, isn't it? Blepharo.
Yeah.
Yep, it's supposed to be plasty. So what you would do as a coder, you don't read the whole report. Not yet. You go and you start with the statement, because this is what Dr. John Good said he did. So you go to the index and you look up probably blepharoplasty, upper lid, and you come up with your code, and you might find that there's one or two or maybe three different types of blepharoplasty codes. If you don't have enough in this statement to pick one, then you go and you read the body of the report. So they call it abstracting. You're abstracting the info that you need to get the correct code. Now, you do read the op report to see if there's anything extra that the physician did that you should code also. And where your skill comes in is you start to learn things like an oophorectomy, removing an ovary. Then you see, ooh, they did a laparotomy. I should code that. But what you learn in coding is, no, you don't code the approach. You don't code the path to get there. So if they opened up the abdomen, laparo, right, and to get to the ovary to remove it, the oophorectomy, then you don't code the laparotomy. It's bundled in, okay? So as you're reading this story, that's what you're skimming for, just coding some extra stuff, okay? And if you find that, then you go ahead and code it. Now, you could go ahead and code it and then maybe pop it into a, what's it called, checker? CCI checker, which that's the correct coding initiative. It's where they basically tell you if the Medicare considers the two codes bundled, or one's bundled into the other. And that's how you learn. So this is actually a good, this is what we do in our practicum course. We use Practicode as the background for the course, and you code live cases like this. You log in as if you're a remote coder, and on the left-hand side, you've got your note and your demographics on the top. They're made up, of course, because it's practice. And then on the right-hand side, you've got a box to pop in your diagnosis codes and your procedure codes. And then you hit submit. Now, if you're a real coder, off it goes and your next report pops up. But because this is a training program, the rationale pops up, and it gives you a score on how well you did. And then you learn from it, and you go, oh, I coded that CPT code, and I shouldn't have, it was bundled. And you read the rationale, and you figure that, and you go on to the next one. And you keep doing that, and you start to build up your proficiency and your speed of coding real cases, not multiple choice scenarios, but real reports for a real need to be a remote coder. So we are so excited about Practicode. It was a year ago, if you can believe it, that we had announced working with the Practicode folks. So now we've bundled it into a course, which includes a weekly class that Alicia conducts, and it's been going really well. They go over cases, so things like this. If you want extra help and you've got one like that, say, Alicia, here's one, and you give her the record number of where it's located in Practicode. She'll pull it up, and you'll go over it together and break it down. So definitely a very good help.
And another thing, while Lauren was talking about that made me think, even when I first started coding, I was so excited. I know you can't imagine me being excited, but getting to code, especially diagnosis codes, you will see in patient encounters all of these things you can code. Oh, they had a fever. Oh, they had, swollen feet. Oh, they had this, this, and yet then you learn that you can't do signs and symptoms if you have a definitive diagnosis. And that's the way you learn with this as well. You see these encounters and you want to code everything, and then you have to pull yourself back, and like Laureen said, it's bundled. You can't do a laparotomy, and you don't get to code for them looking around where they're going to take out your appendix.
And here's a screenshot of Practicode on our info page. It's gocodingcertification.org/Practicode. And so you can see the document on the left-hand side, and this on the right-hand side is where you pop in the code. I know it's not probably very clear, but it just gives you an idea of what it looks like. Now, the interesting thing with this is that the makers of Practicode is a remote coding company called Aviacode.
Right.
And Practicode is a scaled-down version of the real application that their coders use. So they will consider your proficiency score. So and the way Practicode works is you go in and you look at what let's say orthopedics or cardio, and you decide, okay, I'm going to become proficient at this specialty. And so you just focus on those cases. You pick that module and you code one, you code the next, you code the next. You'll be painfully slow initially, and then you pick up speed, because that's how real coders start. You got to start somewhere. And now you have this proficiency score. You can apply for a job with Aviacode, and they want you to be certified. But if you have zero experience, you can say, yeah, but I did the practicum with CCO and I got my proficiency up, and they can actually look it up and say, oh yeah, in the last 30 days your proficiency's gotten up to 92% hired. So if they have a need, they need coders. They are getting new contracts all the time. So that, to me, is one of the pieces. A lot of the courses we've built and done had to do with pain points, like what are our students experiencing out there that's a pain point? One of the pain points is, how do I get that first job? So we wrote an ebook on how to help you get that first job. Then it was like we were going to try and build something like Practicode, and then Lori Woods, who runs the what's her Facebook group called? Don't kill me, Lori. Put it. If someone sees it in the chat, let me know, Boyd.
Yeah, because I'm always looking at it.
So Bob was out there, talking about it. She says, you've got to talk to Laureen. And
Create
thank you,
yeah,
Create a Coder. I am going to get spanked so bad later. so it's Create a Coder, and we had a chat, and that night, literally, we were a year ago showing it on screen, and he did a free giveaway, and it's been really great. But you got to use it. You got to get in and you got to do the practice, and take advantage of the weekly classes, because that will really help you get the most out of it. I was coming here for a reason. No, I forgot.
I think to show them where the Practicode course is, maybe?
Oh, no, I just did that. It was something else. I'm sorry. Something I wanted to show them on the main site, but it just left me. I'll come back. All right.
It's because your brain is so full of knowledge.
Get more CPC exam tips, coding certification training, and CEU credits. go to www.codingcertification.org.